Welcome. In this video, let's continue. Till now we have seen that under modes of intervention we have health promotion, specific protection, early diagnosis and treatment, disability limitation, rehabilitation. We have finished the details of health promotion. So now we are moving on to specific protection. Fine. So specific protection is to prevent again, okay, but it is against a specific disease, so it's like immunization, okay. So it is also prevention only, and it is going to be against a specific disease. Now under specific prevention, first you'll have to give an introduction. It's a specific disease prevention, so it's prevention of a specific disease. Not all diseases can be prevented this way, so it is for a limited number of diseases, limited number of cases or diseases, let's say, okay, and you're going to intervene to avoid this disease altogether. It is concrete and effective, okay. So what are the actual interventions? Here you will have to mention immunization. You can give a lot of examples here, like smallpox immunization, which eradicated it. You have polio, which has almost eradicated it in India at least, and diphtheria, etc. Diphtheria, you have DAPT, right? DAPT is the vaccination. Then you have nutrients, like vitamin C causes, like deficiency of vitamin C causes scurvy. So you will make sure that some nutrients like vitamin C are available. Then you can write fortification again here, iron for anemia. Then you can mention vitamin A for night blindness, etc. Then you can mention defluoridation, defluoridation of water wherever fluoride is rich in water, only in that area. If necessary, you can write here, if necessary. Then you can do iodization of salt. These are all fortifications, you can mention them. To prevent what? Iodine deficiency, thyroid gland it affects. Then you can say usage of condoms for prevention against AIDS and other STDs, okay. Then you can have prevention of occupational hazards. Then protection from carcinogens, so you can prevent cancer, prevent carcinogens like tobacco, etc. Then here you can add avoid allergens. Then you can avoid you can monitor safety of foods, okay, to prevent any Staphylococcus aureus kind of a infection. So basically specific protection. So this is where you're trying to protect against a specific disease. So you can say here which is the disease and how you protect, like diphtheria. How do you protect? Immunization. How do you protect against scurvy? By giving vitamin C. How do you protect against anemia? By giving iron. Then defluorid, if there is excess fluorosis, then you will defluoride water if necessary. Then if there is thyroid gland problem, then you will give iodized salt. Then if there is AIDS and other STDs, then you can use condoms against STD AIDS. You can prevent occupational hazards. Cancer can be prevented by preventing carcinogens. Allergies can be prevented by allergens. And then any foodborne infections can be stopped by maintaining safety of foods. So this is going to cover specific protection. So if they ask you specific protection, then you have to write this. This is preventive measure, fine, for a specific disease. Now moving on, we have 3 more points here. Early diagnosis and treatment. Mainly this involves physicians, right? And any changes in homeostasis you're going to recognize, and any functional changes or biochemical changes are going to be found out as early signs and symptoms are going to be, you're going to catch them, and then you're going to protect it from becoming chronic, right? And they are highly important in reducing morbidity, mortality in diseases. And you can also, it's very good in terms of hypertension and breast cancer, etc. Many STDs also, tuberculosis, etc. It is the only effective mode of intervention, they say. This is interesting here. Let's just write it down. So you will recognize the early signs and symptoms and save it from becoming chronic. You will check the changes in homeostasis, functional changes, etc. You are going to check, and then you are going to diagnose and treat it. So basically this is a secondary prevention and could be tertiary also. You will give examples here. Examples, you will give hypertension. For hypertension, how you will prevent, you will control it so that it doesn't grow up into a heart disease. Then you have breast cancer, which can be diagnosed early. This is a very good example that you can give. Breast cancer early diagnosis with mammography. And then you can also mention, you can control or you can reduce morbidity, mortality. So that is what about early diagnosis and treatment. You can elaborate on all these based on the marks. So this is going to be a secondary prevention. The disease has occurred and you want to reduce the morbidity, mortality. Basically here, early diagnosis and treatment, best example here would be cancer, breast cancer, mammography. Okay. So you will recognize the signs and symptoms in the early stage. You will check the changes in homeostasis and functional changes, and you will make sure that it doesn't become a chronic disease. You can also write about tuberculosis here. Fine. So you'll have to treat it early.